What's up, everybody? Welcome back to another vlog. Thank you for tuning in. If you saw my first two videos and you're watching this third one, thank you for being curious, and thanks for your support. Thanks for watching it out and just following me along this journey. If you are somebody who's coming across my videos for the first time and you are potentially going to have double jaw surgery, I recommend you go back and watch the other videos that I made about my story and kind of where this all started, why I'm doing it, and two, kind of the procedure details, how the surgery is done, and what it's going to look like specifically for me. Today's video is basically going to be talking about the timeline and the journey in terms of the checkpoints, milestones, and things you should expect when starting something like this and going through the process of getting double jaw surgery. Now, it's called maxillofacial surgery, oral surgery, facial reconstructive surgery, whatever you want to call it, but double jaw surgery. So I want to talk about day one all the way to day whatever, Z, when you're finished, day 100. So day one, I want to start with assuming that anybody watching this, and just to fast forward and make the video shorter, you've decide that you want jaw surgery, you need it, your orthodontist has told you need it, you have a cross bite, you have an underbite, you have an overbite, whatever it might be, you need the surgery. So what then happens? The first 12 months or so, could be 6, could be 16 like me, is just all braces. So the beginning of the journey, the beginning half, or beginning 60, 70% is basically just orthodontics work. There's nothing really happening. You're meeting your orthodontist every 3 weeks, 4 weeks, a month, whatever it might be. You're getting your teeth adjusted for your new bite. My orthodontist has done surgery or worked with patients who have surgeries like this. Obviously, me being one of them, so he kind of knows where my teeth should be for my new bite and what my mouth is going to look like. So that's kind of what happens in the first 6, maybe 12, maybe 16 months. So then fast forward to 1 month, schedule an appointment at a lab to get a urine test as well as blood test. Fast forward a little bit further, you're 2 weeks out from surgery. You've had your pre-op surgery planning with your surgeon and doctor like I've had just recently. They take, you go to the radiology department, they take x-rays of your face, they take photos, and then they also have to take a CT scan that is then submitted to a company that produces something called VSP, or Virtual Surgical Planning, which is basically a template and blueprint for the surgeons to look at and predict and tweak what the surgery is actually going to be like. So it actually, like what it's called, it virtually plans the surgery ahead of time. So it shows where the cuts should be, what the adjustments should be, and what I'm going to look like afterwards too. In terms of like the actual bone structure. The soft tissue, you can't predict that. And what I mean by that is when I heal the scar tissue and the muscles, that's kind of hard to tell. So I can't predict that, but it can predict what I'm going to look like in terms of my bite, you know, and my smile. So they'll adjust that. So that happens about 2 weeks before surgery. And also, if you don't have hooks on your braces, which you probably don't, today I went to the orthodontist to get my last checkup and last tweak before surgery. So now I'm officially good to go. I'm green lighted. My mouth won't be touched by my orthodontist for the next couple of months, obviously, because once I'm out of surgery, once I have surgery, I'll be recovering, and it's too sensitive for him to go in there and kind of pull rubber bands out or move wires and tug my jaw. So I went today and I got surgical hooks, and they're very annoying, and this is what they look like. And pardon me for looking at my mouth. If you don't want to look at my teeth, then just look away, but this is what they are. So you can see these hooks on the bottom here, there, and on top. So right there, and they go all around. So those are surgical hooks, which are put in place so that once the jaw is broken and you have surgery, rubber bands can hold your mouth together. Okay, so that's about the 2 week pre-surgery. You've got the planning, you got the hooks, you're ready to go. You have the surgery. Surgery can take between 3 to 6 hours, depending on what's gonna happen for you, what they're gonna do to your mouth. For me, it's gonna be 5 to 6 hours. And I'm gonna kind of talk about briefly the first week. So I wake up in the hospital, you're really swollen, you have a jaw bra on, you're expected to stay in the hospital from at least 1 to 2 nights. And basically they only release you if you're able to hit these 4 goals, which are you're able to drink about a half liter of fluid and hold it down without being nauseous or vomiting. You're able to go to the bathroom. You're able to have a short walk, so stand up, maybe use like your hands on some sort of bars or a walker to kind of maneuver a little bit so that you can stand up. And then the last thing, the 4th thing is that your pain is controlled with oral medication. So they want to make sure that once they remove the IV, which is pumping in meds into your bloodstream, that you can start taking a syringe of oral medication and pain meds so that you won't be in pain. Then you go home. What to expect for the first week when you're home. So again, like I mentioned in my earlier videos, the surgery, the cut's very high up. Expect bleeding. Because of the bleeding from your nose, it can drip down into your stomach and cause vomiting. So expect possibly some vomiting. Now again, this doesn't happen to everybody. Some people don't have nosebleeds or vomiting or anything like that. They're just recovering and they're just really swollen. Swelling gets the most extreme by the 3rd day. From that point on, you should be chilling. Pain medication lasts for about 5 to 7 days. So I think after the first week, I'll be pretty much good. You have a meet at 1 week with a surgeon or orthodontist who checks your mouth. They change your rubber bands, which are again on these hooks in my mouth. They check my bite, make sure it's kind of going in the right place as it needs to be, maybe make some minor adjustments, but really not really, because plates and screws are holding my mouth together. So that happens week 1. Week 2, second appointment. At that point, you might get some scans, practice some joint exercises, and all this time you have to practice breathing exercises so you don't get pneumonia. Also, oral hygiene, so mouthwash that they give you, as well as saltwater rinses so you don't develop thrush, which is like an infection on your tongue. So second week, you check up with them. You get a scan. Let's see, you maybe get your head wrap adjusted or a new one, but now it's only at night, according to this surgical planning calendar that I'm looking at. Fast forward to week 3, stop wearing your submental head wrap. May brush teeth, no floss or mechanical toothbrush, so you can start mouth care, light brushing your teeth by finally the 3rd week, if you can imagine that. By the way, the first 2 weeks or so is liquid diet, pure liquid diet, particle free through a strainer, and weeks 2 through 4 are basically, no, actually like 2 through 6 are like blended food or pureed food, and after that you can go to soft chew foods at like week 8-ish and do that for a little while until you can finally start maybe chewing something, which is about like 3 months out. Week 4, meet again with the surgeon. I think you meet with the surgeon basically for once a week for about 8 weeks. Week 4 may start no impact cardio exercise, so nothing that causes your jaw to clench, basically lifting really light weights or basically just walking on a treadmill, maybe a Stairmaster. Week 5, just another appointment, just a checkup, see how things are going. Nothing really happens then. Week 6, meet with your surgeon again. May experience acne breakouts for the next few weeks after that. 7th week, another checkup. Week 8, another checkup. Let's see. Elastics. Now, elastics depend on every surgeon, but the elastics in your mouth depends on who you're going. But with this calendar I'm looking at, elastics are worn now only at night, at week 8. So that means all the weeks prior to that, you were wearing your elastics basically all day. Patients are then cleared for gentle nose blowing at week 8. Straws, drinking out of a straw, swimming, head underwater, hot tubs, cardio, and weightlifting, no clenching again, and then sleeping on your side. So the sleeping on your side actually doesn't matter so much for me, I don't think. Actually, maybe it does. But it's more so if you're getting a cheek graft, you can't sleep on the side of your face, you can't put your face against a pillow, because you'll wake up with blood all over the pillow and just, it's not good. Week 9, 10, 11, 12, appointments, soft chew diet, medium risk patient at that point. And yeah, by that point you should be smooth going. So at that point you're around 3 months out. You've been able to get through the liquid diet of 2 weeks. You've been able to get through the blended like smoothie diet of another 6 weeks after that, which gets you to week 8. Then you're at soft chew diet. You reach some more milestones along the way, as I mentioned. until you get to about 3 months. Your jaw is looking pretty good by this point. You're starting to be able to eat some normal foods, maybe grilled cheeses, stuff like that. And then 6 months, you should get some feeling back in your face. Hopefully all the senses back in your chin, hopefully coming back. There is a risk for that permanently to be lost. Swelling is still not all the way down. Sometimes it takes all the way up to a year for your face to go back to very, very normal the way it is right now. But that's kind of it. Braces are on this entire time. Sorry, my phone's going off. Braces are on this entire time. And potentially some patients get their braces off at the 6-month mark. So if I'm getting my surgery in June 3rd, which I am, ideally I get my braces off sometime around December. Would be a great Christmas gift to definitely get rid of these braces. I've been hating them. They suck, as you can imagine. But could be longer. Could be 8 months, could be 10 months, could be another year of braces afterwards. It really is just up to your orthodontist, how your bite's fitting, and small minor tweaks. So that's pretty much it from day one all the way through surgery, kind of what to expect, recovery. I mean, there's so much to talk about. There's so much stuff that I can give more details on. I've got like packets and packets of information in front of me, but in the sake of making videos not 30 minutes long, I think that kind of gives you a rough idea. If you have any questions, feel free to let me know in the comment section. I'd be happy to answer them if I have the answer to them. Some stuff I might not. Obviously, I'm not a doctor. This is all just stuff that I've been learning about and been told. So that's kind of the rough outline for the timeline, and that's kind of what I expect. So I'm possibly about halfway through this whole thing, which is kind of scary to imagine because it's been 16 months. I don't know if I'll get my braces off 6 months after surgery, which may make me closer to the 75% way mark. Yeah, fingers crossed. That's kind of what to expect. So thanks for watching, guys. Like the video, comment, subscribe, share the video if you know somebody that's going through this procedure. If you're about to go through this procedure, then hope this video is helpful for you, and be sure to check out next video.